So maintenance of your full arch implants is very, very crucial to the longevity of your implants. Following strict protocol on daily hygiene as well as professional cleanings with your general dentist is very important. I'm going to demonstrate here how you're going to utilize your Waterpik, your floss threaders, brushing, as well as using a Proxy brush. You want to use like an infant toothbrush. You can continue it throughout the 4 months or so of the actual healing, but it's important to use something ultra soft because it can flex and get between the prosthesis. Okay, so you want to angle it, this soft bristle toothbrush, angle it right into the gum, into this area. You want it between the pink tissues and the prosthesis, going at a 45-degree angle in circles like this. You want to massage the gums, and don't think that you're damaging the gums, you're actually tightening it up. And it's okay that it bleeds for the first few weeks, that's normal. It will tighten up over time. And at the bottom, same thing. You want to brush it all onto the inside here, along the gum, underneath the prosthesis, going side to side in a little circle. And on the inside, you want to kind of tickle the roof of the mouth, holding it vertically, and then onto that side. On the lower, same thing. Angle it towards the gum. And again, using an infant toothbrush like this really gets deep into the interface of the prosthesis. You can do the same thing with an adult toothbrush once the gums tighten up. So there's a little tuft of bristles here, and it has a little wire inside, and it can kind of bend if you bend it a little bit. And how we use this is we go in between each of the implants. And you bite down when you do this, and you want to go into that area, and you go side to side. And in areas where it's too tight for you, don't force it. Just go as deep as you can go. Initially, when the gums are inflamed, it's going to be really tough to do that, but get it as far as you can without hurting yourself. And on the bottom, same thing, and going side to side. So you want to take this floss threader here, and the floss threader looks like this. It's like a needle and thread. Then you go into the mouth, okay, and you want to gently just kind of push it through and open, and you grab it from the inside, and you're going to go shimmy back and forth like if you're shining a shoe, back and forth. And you're going to do that in between each implant. So initially, when you're starting to use your Waterpik and your gum tissues are still healing, you want to initially use diluted hydrogen peroxide. There's different tips that's included with this. There's a little rubber tip here that kind of actually massages the gums. You can kind of, put it right underneath the prosthesis. There's one with a brush on it, and there's a tongue cleaner one too, with a little spoon. You just simply attach them to your Waterpik. You lock it in, you turn it up to a lower speed and slowly work your way up to when your gums are healing better and it's not as sore. You can increase the strength. Adjust your speed, and once it's inside your mouth, that's when you want to turn it on. But this works wonderfully. You can pressure wash all of your implants underneath your prosthesis, but do not Waterpik around zygomatic implants. So if you're a patient that had gotten zygomatic implants in the back part of your jaw, you don't want to Waterpik those areas. And that's pretty much it. Basic oral hygiene instructions. Adult toothbrushing, baby toothbrush brushing, Proxy brush, floss threaders, using the glide floss and the floss threader. And then lastly, use your Waterpik. And do that every day, twice a day. And your investment will be protected.